Um, so today I'm going to talk about um, the fever workup. And a lot of times you'll get called on a patient, and the nurse will say either this patient has a fever, or they'll give you a temperature. And usually the call for parameters is call a house officer for a temperature greater than 38.5 or less than 36. The technical definition of a fever, depending on what you read, it's temperature greater than 37.5 Celsius. However, for medical purposes, in terms of what we actually worry about, if the temperature is trending up, then you're concerned that the patient might be developing a fever, there's an infection, or something's wrong. Um, but in terms of hard numbers, we usually use 38.5 as the cutoff for a fever um, when, in terms of being worried clinically. Um, so when you get page that a patient has a fever, look at the fever trend. Is the patient's temperature been going up? Have they been receiving Tylenol, which would make their temperature falsely lower than expected? Um, has the patient had a fever workup already? Meaning, did they have a fever yesterday, and did were cultures already sent? If cultures were sent the day before, you don't need to do any additional workup. You just need to wait for the results from the previous workup. But let's say this patient has a new fever. So the usual fever workup is a urinalysis with micro, a urine culture, um, a chest X-ray to look for pneumonia, um, respiratory culture, which is a lot of times it's false positive. You have respiratory or oral flora that grow. Um, but let's say your patient's intubated, you're in the ICU, you can get a trach aspirate. If there's something abnormal in the chest X-ray, you can also do a bronchoscopy and do a bronchial alveolar lavage as well and send that for culture. A lot of times we do blood cultures as well. Sure, you might get some false negatives, but you might get some positives. You do a veni culture. I'm sorry, a veni puncture. And if they have a catheter like um, a central line, a lot of times we also culture from that too. So one from the periphery and one from the central line, or one from the either an IJ or a PIC line, etc. And you look for sources of infection. Are they a surgical patient? Do they have redness around their incision? Have they been coughing up? Maybe they have pneumonia. If you can't find any source of fever, you start to look at a greater differential and include more things in. For example, do they have a DVT? Do they have thrombophlebitis, etc.? Patients with a fever, there's a wide differential for that. But a lot of the times for hospitalized patients, again, to review, the things you look for or the orders you place are UA, urinalysis, urine micro, urine culture, chest x-ray, blood cultures times 2. One of those could be a venipuncture. The other one could be one from a central line. And that's pretty much it. Again, to review, temperature-wise, you look for a trend. Has the temperature been going up? You also, if you're looking for hardcore numbers, you would send cultures if they have a temperature greater than 38.5 usually. Of course, someone who's immunosuppressed, someone who's older, you might not actually see a temperature. You might just see a rising white count, which is actually another thing that you would also send off. You would send off a CBC if you haven't already, and you would always look at the trend. Is the white count going up? They could be, they can have a hot, significantly elevated white count, meaning that greater than 10,000, or they can be neutropenic, so less than 4,000. And people can be on either end of that spectrum. You also want to look at the differential as well. How many segs do they have? How many neutrophils do they have? Etc. So I think that's just a quick summary of the fever workup in hospitalized patients. If they're spiking fevers, just start empirical antibiotics or empirical treatment based on what they might could likely have. I think that's it. I hope you guys have a good day, and if you found this helpful, please subscribe, and I will talk to you later. Bye.